Hello everyone, welcome to Sharmit. In this session, we are going to talk about another very important topic related to medical coding anatomy, and the topic name is Contralateral Anatomical Term of Direction. If you remember, in our last session, we talked about the Ipsilateral Anatomical Term of Direction, right? So this session is in the continuation of the same, where we are going to talk about the opposite of Ipsilateral, and that is Contralateral. Okay, so today we will see what is contralateral, why it is utilized in the medical coding, and what kind of information basically it provides when we are going through these kind of terms that contains the contralateral keyword. Okay, so these all things we are going to discuss in this session. Additionally, I will provide you some of the tricks to remember these concepts for your interviews and exams, and we will also cover some of the exam related questions as well. But before we proceed further with this, I would like to recommend you to please go and check out the previously released session first, because they all are in proper sequence and sync. So if you follow it sequentially, then it would be much more easier for you to understand the ongoing topic, because for time being we are just mainly focusing on how to use mainly we are focusing on contralateral anatomical term of direction. Okay, but prior to that, whatever we have learned so far, you should know about that, right? And for that, you can also refer the Sharmit digital course book, which is freely available in the description box. There you will find more than around 3,600 plus sessions available in both Hindi as well as English language. So without any language barrier, you can easily consume the content. Okay. Alright, so let's start with the definition itself. What is contralateral? So contralateral means the opposite side of the body. Okay, so in simple word, you can say that when two structure or findings are located on the opposite side, then the right side and the left, like suppose some structure is at the right side and other structure is at the left side, then they are described as a contralateral to each other. Okay. So contralateral means opposite sides of body. Few things on the one side and few things on the other side. Okay. So you can conclude that contralateral means opposite side of the body. Now, if we talk about the origin of this word, then it is compounds of mainly two words, and this word comes mainly from the Latin. The first word, that is contra, is just opposite and against. Okay, and lateral means side. So when we talk about the opposite side, it's contralateral. So literally contralateral means opposite side, because from Latin words contra, it means opposite, and Latin word lateral means side. So it is literally a contralateral opposite side. Clear? Now if we talk about the opposite term of this contralateral, it is ipsilateral. And those who have already watched the previous session, they know that we in last session we covered the ipsilateral, which is the same side. Okay, now we will talk about some of the examples through which you can easily understand like how these things provide the information. Okay, so let's see the first example. A right brain stroke caused the contralateral left side weakness. Okay, so where is the stroke? Stroke is at the right brain. Okay, a right brain stroke that causes a contralateral side left-sided weakness. Okay, so what we noticed here, we are talking about two things and they are contralateral to each other. They are up on the different sides, right? One thing, damaged brain is on the right, like damage to the right brain cause weakness on the left side of the body. Okay, so this is how it provides the information. Second thing is the contralateral knee was examined for comparison. Okay, so the opposite knees was examined along with alongside the injury knee. Okay, so what is contralateral knee? That means both knee, one on the left side of the body and another one on the right side of the body. Clear? The next is contralateral lymph node spread indicates advanced cancer. Okay, so cancer has spread to lymph nodes on the opposite side from the tumor. Okay, The last example says the contralateral kidney hypertrophied after nephrectomy. So it means the remaining kidney on the opposite side enlarged after the other was removed. Now what is one common thing between all these sentences? That is contralateral, and in meaning you will find it means on the other side, either on the left side, on the right side. But here, like, one structure should be at left and one should be at right, opposite to each other, not at the same time, not on the same side. Okay. Now the next thing is medical terminology, right? So there are lots of medical terminology where this word has been used, but for now we will just go through a couple of examples. So here you can see medical term contralateral breast cancer, which means a cancer in the opposite breast from the originally treated breast. So here contralateral means different side, not on the same side but on a different side. The next example is contralateral lymph node metastasis, which means cancer spread to the lymph nodes on the opposite side from the primary tumor. The next example is contralateral hemiplegia, which means paralysis of limbs on the opposite side from the brain lesion. Then we have contralateral homonymous hemianopia, which means visual field loss on the opposite side from the occipital lobe damage. And at the end we have one more example that says contralateral neglect syndrome, ignoring stimuli on the side of opposite to the brain lesion. Now if you compare all these examples, you will find only one common thing, that is contralateral. So wherever we are utilizing the word contralateral, that means we are talking about the opposite side. Okay. And in last session we talked about the ipsilateral, which was just explaining us about the same side thing, right? But here we are talking about the contralateral. Okay. Now as we have learned so many other topics, so we should know about at least a few things that can help us to identify what is contralateral in exams. Okay, any trick. So for that, here I have noted down some trick. Contra means against or opposite, right? So like the word, we have one word contradict, right? That means to say the opposite. Okay, if something is contradicting something, that means it is opposing something, right? So here from contra you can relate it with contradict, so it will remind you that yes, contradict means opposite, so it is contralateral means opposite side. Another way is to, like, just like a contradicting someone means saying the opposite word what they said, right? So here if you take the example, a right brain lesion contradict that goes against what you expect, it causes left side symptoms. Okay. Another best way to remember this is here in contralateral we have letter C. Okay, so just consider C as crossover, so the opposite side. Okay, so think of it as crossing the road. You start on the right side of the road, you cross over to the left side. The left side is contralateral to where you started. Okay, so when we are talking about right brain stroke, left body weakness. When we are talking about the left brain stroke, right body weakness. So the symptoms are always on the contra or the opposite side. That is, if the things is happening on the left side, it will impact on right side. If it is happening on the right side, it will impact on the left side. But if we compare it with the ipsilateral, it is completely opposite, right? Because in ipsilateral case, everything is happening in the same side, either on the left or on the right, right? But in this case, when we are talking about the contralateral, they are opposite to each other. So I think now you have clarity on both the terms, what is contralateral and what is ipsilateral. Okay. So yeah, that's all for today, and there is one question for all of you, and today's question is, what is ipsilateral anatomical term of direction? So in our last session we talked it in detailed manner, so I'm sure you know the answer of this question. So please do share your knowledge in the comment section so that others can take a reference from it. But in case if you don't know the answer, you can refer the previous session where we have discussed it in a detailed way, so from there you can learn and then you can share your knowledge. But when you share your knowledge, it will not only help others, but it will also instruct me that you are learning from these series. And according to the number of response you will share in the comment, accordingly I will publish more sessions for this playlist. Okay, so yeah, that's all for today. See you in the next session. So thank you for watching Tech Sharmit.